This is an unusual podcast entitled Botox for hair transplant surgery. Botox or botulinum toxin therapy is something that's very, very confusing because it should be done for cosmetic wrinkles on the face. But for hair transplant surgery, I actually use it for a couple purposes. The first purpose is pain. Now, fortunately, in my hands, I've never had anyone with chronic pain in the donor area from previous donor harvesting. But I've unfortunately had to treat pain caused by permanent nerve damage by other places. So if you are one of those unfortunate people that have chronic nerve pain from damaged tissues from somewhere else, I really would encourage you to come see me because I am very, very confident that I can fix it. Again, I've never, ever in 20 years had permanent nerve issues from this. So I don't want to scare anyone from doing this. It's quite rare, but in inexperienced hands, you can cause nerve damage. So Botox therapy into either incision or the area where there is a donor harvest that causes pain. Just a few units placed directly into the area can cause significant pain relief. So this is a huge thing. Now, some of my patients immediately in the post-operative setting, like in the first few days, they have more discomfort than they bargained for, and that's a very small minority. I would say less than 5%. But what's really amazing is if someone says, I'm having a 7 out of 10 of pain right here, I put a little Botox in and it is gone almost immediately. Sometimes it takes up to 30 minutes, but it doesn't come back and it's managed. So this is not hopefully a scary podcast, but one thing that you may not have thought about. I also use it for scarring, for patients, younger patients, or any patients that have an incision in the back of their head that may risk scarring. I put Botox in it, and actually significantly can improve the any scarring potential. So Botox is something that I've been using for close to 20 years, but clearly these are new ways to understand what Botox does. Now, if you ask, how does it manage the pain? Honestly, I don't know. And it's so fast. I've actually helped pain in the head, the neck, the shoulders, the back, the chest, the arms, the hands, the fingers, the knees, the ankles, the toes, everything on all parts of the body with almost instant pain relief that's very durable and that you don't need to keep doing. Oftentimes, even with chronic nerve issues from other places, I've found that Botox, if you do it 2 or 3 times, starts to extinguish it, and oftentimes it's completely durably improved. So, if you're listening to this podcast and you're not even having hair transplant surgery, Botox for chronic or an acute pain is an incredible treatment. If it's targeted, I consider myself a sniper. I go in there and just hit the pain level. It works really well. In terms of scar formation, there's a study that looked at, it was a double-blind, placebo, randomized, prospective split scar study where one side of the thyroid scar at a week was injected with saline or salt water, that's a placebo, and the other side was injected with a few units, like 5 to 7 units of Botox or botulinum toxin, and the side with the saline at 6 months had a more noticeable scar. The side with the botulinum toxin was near invisible. So I always cite that study because it's pretty incredible that botulinum toxin can significantly modulate or scar tissue in a very impactful way. And to me, it's an important adjunct to all types of cosmetic surgery, but in particular, I have found it to be incredibly powerful for any kind of surgery of hair transplants in certain select patients for both pain and also scar avoidance.